Hello. Thank you for taking a moment to view our Family Medicine Midwest abstract submission tips and trick video. My name is Sarah Ortega. I am with FMM's and IAFP staff as the Education and Accreditation Manager. Today we have two volunteer leaders with us, Dr. Jonathan Dickman with Allina Health United Family Medicine Residency in Minnesota, and Dr. Lisa Phifer with Deaconess Family Medicine Residency in Indiana. Before they get started with content-related slides, I'd just like to offer a few administrative reminders. First, please confirm you've included all required fields for your submission type. Double check if your submission requires a proposal. Please use spell check before submitting, and be mindful of deadlines. Late submissions will not be considered.
Welcome. My name's Lisa Phifer, as noted, and we're excited to have you submitting for Family Medicine Midwest. We just want you to remember that all family physicians innovate, and Family Medicine Midwest is a great opportunity to share what you've learned from those innovations. We have formats suited for all type of innovations and presentations, and in a minute, we're going to dive more into those different formats. Make sure as you prepare your submission to pick an engaging title. This is what is released and draws people into your presentation. And we want attendees to be excited about attending your talk. Make sure you have a plan to interact with participants. That may look different depending on the type of format, but we want to engage our audience throughout the conference. And have a mentor or colleague read your submission and give feedback prior to submitting. So we have a long list of types of submissions, and we'll go through each. And these include workshop, seminar, presentation of scholarship, posters, learning from patients, breakfast roundtables, and innovative ideas. So we do have a format to suit you. We'll start off with workshops. Workshops are 60 minutes in length for most, although we do have pre-conference workshops that can be up to a half day in length. These are hands-on sessions where learners can engage and learn about a topic in a hands-on way. Workshops with a medical student focus are given preference. We want presenters to prepare for having up to 40 attendees in the workshop, and you need to be able to be responsible for supplies, setup, and cleanup. If you've previously submitted a workshop, you are welcome to apply again. Last year, we had workshops on point-of-care ultrasound, dermoscopy, colposcopy, skin biopsy, OMM. There's many possibilities. The next type of presentation is a seminar. These can be either 30 or 60 minutes, depending on how much content is there. And this is sharing practical information on many areas of family medicine, including healthcare delivery, outreach, advocacy, or quality improvement work. These types of presentations need to include two components. They include the traditional parts of background, methods, results, and conclusions for the educational presentation. And then they must have a component for audience participation. We want to engage our audience throughout, and this can be case discussions, small group, role playing, action planning, engagement and advocacy work. We just want you to be aware that simple question and answer is not quite what we're looking for. So seek out opportunities to engage the audience in these submissions. Presentations of scholarship are 15 minutes long, and this provides an opportunity to present about research, curricular design, scholarship, community service, QI, and these projects should include that traditional components of background, methods, results, and conclusions. These projects do need to be complete and have the results and conclusions done.
Posters are similar to the presentation of scholarship, only, of course, in poster format. This is a great opportunity to meet people as they go along and visit your poster and get to talk to people who are also interested in the same topics that you are in. These are not for case studies. These are for research, scholarship, curricular design, clinical programs, and so forth. They don't have to be completed projects at the time of submission. You do have to explain exactly where you guys are at with your submission, but there are two different types of poster submissions. There's one where it's already completed, and there's one that's still in development. So unlike presentation of scholarship, this is also an opportunity for projects that are still in development. Students are going to be given the highest priority for acceptance, followed by residents and faculty. There oftentimes is plenty of room for both residents and faculty to present. Learning from patients. So for the previous submissions, that was not for case presentations. This is where you're going to present those interesting patients that you learned from either during residency or during your career. This is where you have a unique history or exam findings where it led you to a difficult to make diagnosis, or maybe it's a unique presentation of a common diagnosis. Either way, this here is where you're going to submit those interesting cases. You want to make sure you have your background. Why is this case important? The case presentation itself, and then a conclusion about what is it that we should be taking away in the end from this presentation. Breakfast roundtable. This is a great opportunity to get people who are also interested in the same topics that you're in to have breakfast together and talk about a topic. So many different types of topics can be presented at this time, as it just has to be related to family medicine. And as you know, family medicine encompasses almost everything. So this is an opportunity where you have maybe a brief introduction. Sometimes people have a handout, something to spark a conversation and receive some sort of targeted feedback, or just an in-depth conversation about a topic. And this is a great opportunity to make connections between different people in the Midwest, just about topics that you are all interested in. Innovative ideas. This is a more wide open submission. So this is just an idea that you have. This could be something that you're implementing soon or already have done, and you want to present on that. And it's very brief. It's about one slide, maybe a couple slides, only 5 minutes, about something creative or interesting that you're doing, or an idea that you have related to family medicine. This is a very brief presentation, followed by questions and further discussion afterwards. This doesn't need to be research or a case presentation. This is just a general idea of something that is interesting in family medicine, or that enhances what you do at your work. And what you'll need is a background and the proposed idea itself.
Great. Thank you, Dr. Phifer and Dr. Dickman. And thank you for taking a few moments out of your day to help improve your abstract submission process. If you have questions as you prepare your submission, please reach out to fmm@iefp.com. Should your questions be content related, your FMM staff will be happy to forward this content to our Education Planning Committee co-chairs. Thank you, and we look forward to receiving your submission.